Hello and welcome to our 80th episode of the Stop COVID Deaths webinar series. Magandang umaga po, magandang tanghali at magandang gabi po sa inyong lahat. Kung nasaan man po kayo sa parte ng mundo, welcome po sa ating webinar for today and maraming salamat po for being part of our credible online community. To all those who have just discovered us for the very first time today, welcome po at sana po kayo po ay masiyahan at maging interested po sa lahat po ng ating mga future webinars na i-conduct. COVID-19 has affected people's lives in so many unexpected ways. Beyond just being an infectious disease, as a new emerging infection with limited public health tools during the start of the pandemic, yung pong isolation, quarantine, they became the main instruments for controlling the spread of COVID-19. Ang ibig pong sabihin nito, tinanong po natin at ni-request at may mga instructions po ang mga tao, for the most part, to stay at home as much as possible and avoid yung pong mga interaction sa iba pong mga tao. Ano po? Restriction of movement, regardless of whether this is in the upper, middle, and lower strata of society, staying home and being unable to interact with others, it has brought about widespread mental stress. Meron pong mga nakapag-report na ng mga anxiety, ng kanilang depression, ng kanilang irritability, also frustration and anger. And women and children have been easy targets for the most part in terms of violence and abuse at home. So staying at home may be safe against COVID-19 but not necessarily safe po against abuse within the home. I'm Dr. Raymond Francis Sarmiento, Director of the National Telehealth Center, National Institutes of Health, University of Philippines, Manila. Always a pleasure to be with all of you during our regular Friday lunch date. Marami na naman po ang ating pag-uusapan for today. But before that, it's always a pleasure of mine. I always look forward to our Fridays po because I get to share hosting duties with the Special Envoy of the President for Global Health Initiatives and our own Adjunct Research Faculty at the National Telehealth Center, Dr. Susie Pineda Mercado. Dr. Susie?
Hi, good afternoon, Raymond. Magandang hapon po sa inyo lahat. Saan man kayo naroon, we hope you're doing okay. We hope you're fine. I still hear, Raymond, of people who are our health workers who have family members who are getting sick. So we're with you. We're praying for everyone to recover, those who are testing positive for COVID. I think things are beginning to open up a little bit. But as Raymond just mentioned, bukod sa pandemya, nagkaroon ng maraming problema yung mga lockdown natin, no? Kasi sabi, stay home. Ano nga, Raymond? Stay home, stay safe. Hindi nga safe para sa mga iba na sinasaktan sila sa loob ng tahanan nila. So we'd never shy away from talking about the different dimensions of the pandemic. This is not just about medicine and treatment. It's also about the social impact of what we do to address the pandemic. So pag-usapan natin yan, no? Paano bang gagawin ng ating mga frontliners kapag may hinala tayo na merong child abuse or domestic violence, no? Ano bang gagawin natin? Saan tayo pupunta? Paano natin matutulungan ang ating mga pasyente? So we are going to enjoy, I think I'm going to enjoy this very much. We've got great presenters. We have real experts in this field who will be discussing domestic violence, what we can do, how we should respond, and overall, no, parang anong role ng mga health worker dito sa problema na ito. So, Raymond, over to you. I think TVUP has some interviews for us.
Yes, thank you, Dr. Susie. For those who are joining us for the very first time, we always have this person on the street video. It's a series of videos po that we compiled into just one video. Just to get the pulse of the common folk po in terms of their opinion and their sentiments with regards to the topic at hand. For today's person on the street video, the question that was posed to our interviewees, alam ba ninyo kung may mga nangyayari na pang-abuso ng mga bata at mga kababaihan ngayong may pandemya? Kayo po ba ay nagre-report at saan kayo dapat mag-report? Sa tingin po ninyo, anong edad dapat pwede nang may pag-sex ang isang bata? Sa tingin din po ninyo, anong edad handa na maging isang magulang ang isang bata. So for this video po, TVUP has prepared a very very short person on the street compilation, and we hope you watch this.
Sa tingin ko, pwede nang makipag-sex ang isang tao, syempre morally kung kasal na.
Dapat hindi to minor. Una-una, dapat hindi, ang isang minor de edad ay hindi makipagtalik.
Sa isang mature na pag-iisip na, at dapat most definitely dapat may consent ka or hinihingin mo ng approval ng babae bago mo itutuloy.
Ang isang tao ay handa na maging magulang pag kaya na niyang suportahan ng isang bata na lumaki.
Kung kaya mo na maging responsable to bring food at the table, ika nga.
Pag sinabing abuse to women and children, una, pag-aabuso to physically and mentally, verbally.
Pwedeng pambubugbog, pwedeng pang momolestya, napakaraming factors ng pang-aabuso.
Isang gawa or isang illegal act of the abuser na taking someone for granted with or without consent, regardless of age.
Based talaga sa statistics, tumaas yung level of abuse or domestic abuse, especially ngayong pandemic.
Mas maraming time yung mga tao sa bahay. So mas maraming chance na nagkakaroon nga ng pang-aabuso.
Siguro good thing din ngayon, wala pa akong nabalitaan in my inner circle sa mga kakilala ko na na-abuso physically or any form of abuse during the pandemic. Pero marami akong nababalitaan.
Meron tayong mga government offices na tumutulong para sa mga tao na yun nga, nakaka-experience ng ganitong klaseng abuso.
May mga NGO din na nag-create ng action towards it.
I am personally a victim of abuse and of sexual abuse at that age, and he told me that it has to be a secret, and I had no way of knowing na does it have to be a secret? Do I have to keep it to keep my family safe? Kasi ang sabi niya po sa akin is I will hurt your family if you tell this to the public. He was a family member, and I trusted him as an 8-year-old. You would trust a family member, right? So I didn't give him any consent, but I was so scared of my family's safety. That's why I did that.
Huwag niyo siyang sarilinin. Huwag niyong itago yung nararamdaman niyong pain or nararamdaman niyong pinepent up.
You can speak up, and I hope that the program that you're doing, ma'am, will encourage the public and the youth more specifically to speak up, that it's okay to speak up. At the end of it all, it's about the abuser and not never about the victim.
Thank you very much, TVUP. It's always refreshing to get our person on the street view, and yung na-interview natin who had a disclosure, who actually said that she's a survivor of sexual abuse. We just want to thank her for sharing that piece of information. I think when we think about the impact of the pandemic, we like to think about people getting sick, getting an infection. But actually being abused during this time is very, very traumatic. And if other people aren't there to help you, or you have no support system, maybe the impact of it is worse than COVID, of recovering from COVID. So I don't know, Raymond, parang I felt a little bit, what should I say? Parang I had a very emotional response to our person on the street interview, because I know that we may have people in the audience who have been through something. And I hope that for this webinar, you'll have an opportunity to, what should I say, know where you can get help, and or if you know somebody who is a survivor of violence, then you might be able to offer a hand of assistance. So thank you very much for that, TVUP. Over to you, Raymond. Sorry, medyo dramatic ng konti.
It's okay, Dr. Susie. No, it's not every week that we are able to get that kind of disclosure from our interviewees. So we're really thankful for the willingness and for the opportunity na makapag-share yung ating interviewee for today's webinar, and we hope to those who are watching, maybe watching us in the playback later on, na mag-resonate po yung kanyang storya. All the information that will be provided for this webinar will be helpful moving forward, especially if you know someone, or if you in fact are a survivor of something like this. In the meantime, our webinar po can accommodate up to 3,000 participants maximum. So please join us in the Zoom for you to be able to fully experience this interactive program. We all know that you are setting up all of these watch parties. Maybe you're watching in the YouTube channel of TVUP, or maybe in the Facebook pages of the University of the Philippines, the Stop COVID Deaths po, at saka ng TVUP. Kung nasaan man po kayo, hope you will be able to participate fully. And the only way that you could do that will be in Zoom, but we have provided alternative means for you to be able to participate, lalo po sa ating mga poll, at ito po ang ating Mentimeter. So for those who are, especially for those who are outside of the Zoom, please go to your web browser, enter www.menti.com. Paglapag nyo po doon, you input the code 1202-3249. That's 1202-3249 for you to be able to participate in our fun quiz. And for those who are asking week in, week out, lalo po sa ating mga nag-email, certificates of attendance will be given to those who have watched at least 50% of the webinar duration. This is just a copy po kung at ang itsura po kung ano po yung matatanggap po ninyong certificate of attendance. We have already sent out, at least for the last 78 completely, all of the certificates po. For those who are waiting for at least for webinar 79, please let us know, and we will be also checking up our database po if there are those who are prior to webinar 79 na hindi pa po nakatanggap ng certificate and believe they should be receiving their certificate. In the chat, we also note that there are those who have already received their prizes. Matatandaan nyo po ninyo na last month, I believe, Dr. Susie, wherein we conduct the webinar 75, Fact or Fake, Be COVID-19 Social Media Smart. Meron po tayong mga winners doon. You should have already received an email from the Stop COVID Deaths team with the pickup instructions of your prize at your selected UP constituent university, as indicated in the Google form that you have filled up. Kindly check your spam folders, kasi mayroon pong mga nagre-reach out, lalo po sa Messenger, na hindi pa po sila nakatanggap na kahit anumang pong mensahe. Please check your spam folders in case nandun po nakalagay or nakategorize ang aming message po sa inyo. Again, we would like to acknowledge San Miguel Foods, the food division of San Miguel Food and Beverage Incorporated, for the gift packages they have generously sponsored during the Fact or Fake webinar number 75, to thank everyone for being a part of our credible online community. For those who are joining us for the very first time, we usually have a standard panel discussion format wherein our main speaker will be talking about, in particular, the details with regards to the topic, followed by a set of reactions, and then our Q&A. We will be entertaining questions, not just in Zoom, but also those that are found in the chat po, in the comments page ng ating Facebook and also sa YouTube. Over to you, Dr. Susie.
Okay, thank you very much, Raymond. Again, I'd like to reiterate what Raymond said about those who are watching us on Facebook and YouTube. You can put your questions there. Actually, Raymond is the one who's monitoring that. So Facebook and YouTube, you can put, and we're seeing more people on Facebook and YouTube these days. So just put in your comments there. And those of you who are in the Zoom, you can ask your questions here in the chat, in the Q&A part. All right, so without further ado, we're going to our opening remarks speaker. So we have someone who's very familiar to you. She's the Deputy Director for Operations of the Philippine General Hospital, Dr. Stella Marie Legaspi Jose. Stella, welcome.
Hello, Susie, Raymond. Good morning, good afternoon, and good evening to all of you. We have a very interesting webinar today, And our presenter is Dr. Bernadette Madrid. Her unit, the Child Protection Unit, was acknowledged by the UNICEF as the best child protection unit program in the whole world. They cover 13 cities and 39 barangays. We have three reactors for you, all eminent, prominent people in the field. We have Dr. Vanessa-Ticzon Torres, who is the training officer of the Division of Adolescent Pediatrics. Dr. Lyra Ruth Chua, past president of the Philippine OBGYN Society and is currently the head of the Task Force on Gender-Based Violence, and of course, our prominent lawyer, attorney Katrina Legarda, who will speak on the legal aspects of this situation. Over to you, Raymond.
Thank you so much, Dr. Jose. You will notice po no na we made a slight tweak sa ating, especially for those who have seen the poster, but nevertheless we know that you are looking forward kung sino man po ang usually doing our synthesis and closing remarks. So we hope you'll be able to stay on until the very end of this webinar. But thank you again, Deputy Director Jose, for giving us a sneak peek and opening our webinar po for today. Okay, I think before we proceed with the main event, we will just be doing our fun poll. So we have two questions for today. Okay, there we go. Can we have the one on Menti? Ayun, okay po. So I'll just read off the questions found here in our Zoom poll and Mentimeter. Please do not hesitate to participate in our fun poll. Question number 1 reads, sa tingin po ninyo, anong age dapat pwede na makipag-sex ang isang bata? So, the options here are 12 years old, 13 years old, 14 years old, 15 years old, 16 years old, 17 years old, and 18 years old. So, we are seeing, a little less than 60. Okay, medyo mabagal lang po ang pagdaloy ng ating mga answers. But we are thankful to the 550 plus participants in Zoom and for at least the 46 who have participated po dito sa ating Mentimeter. I'd just like to give a quick shout out those who are joining us from Apalit Doctors Hospital in Apalit, Pampanga, Palawan State University in Puerto Princesa, Dr. Lorenzo P. Ziga Memorial District Hospital in Tabaco City in Albay, and Rojas Memorial Provincial Hospital in Rojas Capiz, as well as the DOH Center for Health Development in Northern Mindanao, Cagayan de Oro. Moving on to question number 2. Question number 2 states, sa tingin po ninyo, anong edad handa na maging isang magulang ang isang bata? So, we have here 10 to 15 years old, 16 to 18 years old, 19 to 21 years old, 22 to 25 years old, 26 to 30 years old, and 31 to 35 years old. We are seeing 265. So, I think that's 270 plus na po. Around 50% of those who are in the Zoom participating in our fun poll, and the same for our Mentimeter participants. Internationally, we are also being viewed all the way from Chonin Hospital in Taipei, Taiwan, Canto City in Vietnam, from Penang, Malaysia, Dubai in the United Arab Emirates, the University of Hail, Saudi Arabia, Lunichi Ali University of Blida II in Algeria, the University of Fiji, Lautoka in Fiji, St. Catharines in Ontario, Canada, and Waitemata District Health Board in Auckland, New Zealand. So maraming salamat po sa inyo lahat. We will not be closing just yet our fun poll as we move on to our main presentation. Over to you, Dr. Susie.
Thank you very much, Raymond. I was monitoring the chat and some were saying, ang early naman, ang aga naman ng mga choices nyo. And you might be wondering why we're asking you these questions. No? So, you know, we are going to talk about a sensitive topic. It's sensitive because people still find that it's very difficult to talk about domestic violence and sexual abuse, but we have to. We have to do this as health workers and we have to understand. And some of the reasons, I remember, Raymond, at some point we had a webinar on children, ano yun? Children giving birth to children. You remember we were talking
Children
about
bearing children.
very, oo.
Yes.
So we were talking about this in relation to teenage pregnancy in the Philippines, and we were saying that there are 50 deliveries a week among children who are 10 to 14 years old. And, you know, 10 to 14 years old, why would they be having sex? Isn't it? Parang, ang reasoning kasi na ginagawa ng iba, kasi pumayag sila, may consent sila or whatever it is, no? So we want to question some of these arguments that are being made about, na kasalanan ng bata yon. Parang, parang problema ng bata yon na pumayag siya. And we will talk about that a little bit more, and especially in the context of COVID, where wala namang kalaban-laban yung mga nasa bahay, no? You're locked up at home, you can't go out. I think this is, as I said earlier, as health professionals, we like to focus on yung ubo nila tsaka yung lagnat nila. Pero what if sinasaktan sila? So I think it is, while it is a sensitive topic, we did want to ask these questions about what is the right age to be a parent, or what is an age when a young person can have sex, because once nagkaroon ng problema, nagiging issue ngayon dito is really na, kasi, victim blaming ba? Yung parang kasalanan ng bata, no? So we want to go a little deeper than what we usually do. And we want to talk about the roots of violence at home, what's happening in our society. By the way, it's not only girls, it's also boys who are being abused. And it has worsened during the pandemic. So we have to talk about it in order to find solutions for this. Not that we know what the solution is, but we have to first talk about it. So first speaker, first cab off the ramp, sabi nga nila, is a multi-awarded pediatrician for her work in child protection. Back in the day, I remember, Raymond, when we were students at the Philippine General Hospital, if you see a child who's abused, you don't know what to do. Like, alam mo nang ginulpe, you can see the fractures, you can see the lola bringing in the child and saying na dapa lang po. Pag x-ray mo, kita mo bali-bali yung mga buto. No? And what we do is, okay, we'll make a police report, what are we gonna do? And nothing, right? It was nothing you could do. We didn't know what to do. But one of those pioneers in medicine, in this field of child protection, decided to create a system. And in that system, everyone in the emergency room should know what to do when you face a child who seems to be battered or a woman who might be abused. And so her work at the Philippine General Hospital spread across the country and took on its own life. As now we have laws, we have what should I say, services available, but admittedly not enough. And during a pandemic, it's even more difficult to get services for those who suffer from this kind of trauma. And I'll use the word trauma because unlike getting COVID, which you might get a mild form of COVID and after that you're okay, this one lingers. I mean, this kind of abuse can incapacitate you for a long period of time if you don't get help or support. Anyway, head of the Child Protection Unit of the Philippine General Hospital, Dr. Bernadette Madrid. Bernie, welcome to the webinar.
Thank you, Dr. Susie. I remember the day when you were Undersecretary of Health. That was when we first started. And we've come a long way, as they say, but there's still so much to do. And the pandemic in some ways have made things worse. So I will put up my slides.
Yeah, go ahead, Bernie.
We're talking. And I'm very happy to be here today and for the opportunity to talk about this topic that is very dear to me and very critical at this point in time in our history. We know that the advice to all is to stay safe. You should stay home now. But how safe are we really at home? Or are the children suffering unintended consequences? Also, the Philippines has the longest lockdown or quarantine for children in the whole world. more than a year, I think at least 1.5 years, if not more, children had been forced to stay home to keep them safe is the rationale. But what's happening at home? First, let's just go to the baseline study on violence against children. And we could see even before COVID, this was done in 2015, that the prevalence of violence against children is very high, both physical, psychological, and sexual. And note here that when we talk about sexual violence, actually there were more males who disclose sexual abuse than females, except that they do not report. But it's high for both male and females. One can even say that 3 out of 5 Filipino children have experienced physical or psychological violence or bullying, and 1 in 5 has experienced sexual violence. So bullying is high, and with online life now, with COVID, we expect that this will be higher. Cyber violence pre-COVID was almost 44%. So this might even be higher now. And witnessing physical and psychological violence or domestic violence is also very high. And that same study showed that most of this violence is happening at home, whether it is sexual or physical. The home is where, unfortunately, this violence is most, where it's highest. And most common perpetrator is someone who is at home, a family member. And so with COVID and with the family members and the children all cooped up at home, remember, not everyone has a big house. Most of the average Filipino has a small house with several generations living in that house, and they're all cooped up in a small space. So it's like a bomb that's just waiting to explode. In this modeling of the effect of lockdown on violent discipline published in Child Abuse and Neglect, they predict using this model that under a high restriction scenario, meaning a lockdown, that there would be a 35 to 46% increase in violent discipline. And in a mild restriction scenario, a 4 to 6% increase. So the conclusion is that policymakers need to plan for increases in violent discipline during successive waves of lockdowns. But what did we see in the Philippines? So the Women and Children Protection Units, and there are 114 of them in 58 provinces across the country, instead of seeing an increase in reports during the first severe lockdown in April and May of 2020, what we see is a very big drop in the reports. A very, very big drop, even more than 50%, down to even some would say 10% of what was previously the number. But we have to be careful about interpreting that statistic. A drop in reports does not mean that there is decreased incidence. Remember that in the beginning of the pandemic, the resources and manpower were mostly shifted to responding to COVID. Many of the Women and Children Protection Units were closed during that first lockdown. Services were disrupted. They were assigned to the COVID wards. Some social welfare offices and barangays were not accepting reports because they said they were busy with COVID. And the usual helping professionals like social workers were also busy with the social amelioration program, and no home visits were allowed for safety's sake. Schools were closed, so teachers were not physically in contact with their students. There was no transportation. People were afraid to go to the hospital for fear of getting COVID. And worse, the perpetrators were at home with the victims preventing them from seeking help. When we look at other countries, we find that it's not only in the Philippines that this was happening. In the United States, the same thing was happening during lockdown. A big drop in the number of reported cases. So a review of those early studies by Claudia Capa and Isabel Gihon showed that there was really a decrease in police reports and referrals to child protection services during this time. There were mixed results with respect to the number of calls to police or domestic violence helplines. Some showed massive increases in the calls. Some showed a decrease in the calls. Studies, though, also showed that even if there was a decrease in reports, there was an increase in child abuse-related injuries treated in hospitals. And surveys done, not reports, surveys reported an increase in family violence. We have done a survey in Valenzuela. We just completed it, and we will be able to give the report by the end of the year. So we'll find out about the incidents. So this observation by the Chief of Section of Child Protection Program in the Philadelphia showed that while their numbers were down, the children that they were seeing in the hospital were more severely injured, and they required hospitalization because of physical violence. And in the UK, they showed a 1,493% increase in the number of patients presenting with suspected abusive head trauma during the lockdown phase. We believe that in the Philippines, there is probably the same situation. Unfortunately, though, we have a hard time recognizing and reporting cases of violence in our country, even up to this time. Why am I saying that? In this case, reported in TV Patrol in April 22, 2021, they reported that a 1.5-year-old was beaten by his mother for crying loudly and possibly waking up his 6-month-old sibling. And this was not the first time that this boy was beaten. The child was previously seen at the Barangay Health Care Center several times with bruises. And a few months before, he was brought to the center when he became unconscious after being beaten by his mother. This time, though, the child died. Then the autopsy revealed multiple bruises with death, probably due to blunt abdominal trauma. The police chief of Taguig, who handled the case, described the mother as maganda naman siyang kausap, magaling sumagot. Ang inaano lang niya may pinagdadaanan dahil wala siyang trabaho at ganito pa ang nangyari, pandemic, na aaburido siya lagi. The mother is an 18-year-old with already 3 children, the youngest being the 6-month-old baby. And the 1.5-year-old who died was the middle child. So there was an older child. So if you compute, the mother probably became pregnant for the first time, even before she was 15. So she was at that age, probably 14 when she became first pregnant. No one suspected that this was sexual abuse. The fathers of these 3 children were different men. And at no point, she became pregnant with these 3 children before she was 18. But no intervention has been done. It was as if this is an accepted thing. Maybe, did she consent? Was this a boyfriend? Those are always the issues that are being brought up, which we can discuss more later in the open forum. So in 2019, the Philippine Statistics Authority recorded a total of 180,916 births to children aged 10 to 19 years. 2,411 of these births were to girls aged 10 to 14. And there was a 74% increase from 2011 to 2019. 70.8% of these infants were sired by males 20 years and older, to these babies born to teen mothers. So the fathers of these babies were adults. They were not teens, but the mothers were very young teens. Okay? So the question here is that, is this an accepted behavior? Obviously, in most of these, no reports were made, nor any intervention done. But research has already showed time and time again that even if these sexual abuse are unacknowledged, the victims suffer the consequences. And if no intervention is done, the abuse will continue. And re-victimization is very high as they grow older, to older adolescents, early adulthood, even up to the elderly years, the consequences of abuse will be felt. Another really big problem that we are encountering now is that suicide behavior is higher among the abused youth during COVID. At the PGH Child Protection Unit, every day, we see adolescent abused teens who are also suicidal. Because on top of the abuse, you also have the effects of COVID, and together, the coping mechanisms of these teens are just overcome. This is the most number of suicidal youths that we have seen through our 24 years at PGH-CPU. Just so many of them. Another big problem that we have, and the Philippines is notorious for this. In fact, we have been labeled by the UN as the epicenter of live stream sexual abuse of children. So during this pandemic, the Department of Justice reported an increase by 265% of online child sexual abuse and exploitation in the Philippines. Around the globe, we are the highest. And most of these children who are victims of this are very young children, younger than 9. So what have we done? Okay, we cannot say that we have solved this problem, but we have learned lessons, and we are now innovating new ways to provide services and to reach these victims who are at home. Obviously, one of their biggest problems is access to services, knowing how to get help and getting there, and for help to reach them. So one of the first things that we did at PGH-CPU is to expand the COVID hotline of PGH to also include child abuse calls. And we have worked with UNICEF to develop child helplines for all the 114. Right now, we have not yet reached the 114, but we have reached 60 of the 114 to be able to have their own child helplines for anyone, women or children who may be abused, to them to call this WCPU to know what to do and what services they can avail of, and to schedule when can they come, or how can they get help, or how can they escape for those who are trapped at home. The services at PGH is also digitalized now with telemedicine because we know that it's difficult to do face-to-face for the safety of both the service providers and the patients. So after the first face-to-face, if we can schedule telemedicine for follow-ups that qualify, then telemedicine is done with them. We had to expand our mental health services because, as we said, we have really an increase in the number of patients who are at risk for suicide. Our social workers who also cannot do direct home visits have to be more innovative. So we have a cell phone or video visit, follow-up, lending the high-risk patients cell phones so that they could be followed up at home, even if there is no physical home visit. Case conferences now, also because of face-to-face is not allowed, is done via Zoom. Parenting, which also is not allowed face-to-face, we had to be more innovative. So one of these is with the parenting tip sheets. In one part of doing this is also distributing the tip sheets together with the food packs. But everyone can actually download this for free, and it is translated into 7 other Philippine languages. This is a project with Ateneo de Manila University, Oxford University, and UNICEF together with CPN. And the tip sheets also has a booklet, and the follow-up can be done by phone or by video, based on these tip sheets. And recently completed research was using Viber. It's called Mapa Chats, and using the Masayang Filipino parenting program. By the way, an RCT, a randomized controlled trial of MAPA, has been completed even before COVID. And this showed that MAPA decreased interpersonal violence and child maltreatment by half. So this is an evidence-based parenting program. And we are now doing the research to see if it could be delivered by Viber, or the next step will also be to try Messenger and evaluate whether it will be just as effective. But we know, as we said, that the children who are trapped in the homes, the nearest point of care and help that they can reach and who can reach them is the barangay. So one of our projects, one of our big projects, is really capacitating the barangay to deliver services for victim survivors together with us at the Child Protection Unit. So capacitating the barangay to do telemedicine, so the patient does not have to go to PGH. They can just go to the barangay and use the facilities there. And the VAUSI desk officer of the barangay is also trained on how to do this. So the training is also done online. Everything is done online now. But we are very happy, together with our partners, UP Manila, of course, the 13 cities in NCR and Cavite, supported by UNICEF. Right now, 39 are functional, but the goal is 55 barangays in 13 cities before the end of the year. And next year, we will also be expanding to Cebu, Baguio, and Davao. The Women and Children Protection Training Centers there will also develop their own barangay tele-CPU centers. And then from there, the rest of the country. So we foresee that this kind of service will even continue beyond COVID, because the reach of these tele-CPU centers is even more than what we have now. And the vision is that even the GIDA areas, the geographically isolated and disadvantaged areas, so long as they have access to the internet, will be reached by specialty service. We have doctors, social workers, police, lawyers, psychologists, and psychiatrists working with us, providing this multidisciplinary teleconsultation. So now, just to update, with the easing of the lockdown, we are almost back to our pre-COVID statistics. As you could see here, the number of new cases seen by WCPUs from January to October 2021. And for CPU PGH, we compared 2020 and 2021. The red is 2021. And you could see the big leap of the number of new cases. And with the telemedicine, we foresee that this will even be more. These are new cases. These are new unique cases. So there is no overlapping of the counts here. Okay. Happy news. That's why we say that Thanksgiving was not only for the United States, but for our country also, because 2 days ago, the consolidated bill increasing the age of statutory rape from below 12 is now increased to below 16, passed the Philippine Bicameral Committee formed by both chambers of Congress, but it still needs the signature of President Duterte to make it into law. So please pray very hard, or if you know President Duterte, encourage him to sign this milestone law, which we have been working for more than a decade. This bill has also an age gap provision about minors who are boyfriend, girlfriends. And so an age gap of 3 years and above is considered sexual abuse. Okay, so I will end here my presentation. Together, we can stop violence against women and children. Thank you.
Thank you very much. That's Dr. Bernadette Madrid. Bernie, thank you so much for that presentation. Excellent presentation. I think really also quite an eye-opener for everyone who's listening. And really, I don't know how one can listen to these statistics and not feel the urgency for action to take place. So it's good to hear that you're doing this tele-CPU program around the country. And I think that I agree with you that post-COVID, this becomes increasingly important because parang sabi ko nga traumatic, no? So parang it's a continuing problem. I think you're pointing out the issue on suicide is also very important. We have talked about this previously with Dr. Banaag, but now sort of putting it side by side with the issue of violence at home, I think we in the health sector need to open our eyes to this big problem, right? That can become worse as this progresses. So thank you so much, Bernie. I mean, I thought it was really an excellent presentation. So I'm going to turn over to Raymond. Raymond, please.
Thank you, Dr. Susie, and excellent presentation again, Dr. Bernie. On behalf of the National Telehealth Center, we appreciate your work for the tele-CPU po. And thank you to UNICEF for the support to the Philippine General Hospital. Our next speaker is our first reactor. She is the training officer of, I think, the Division of Adolescent Medicine with the Department of Pediatrics at the Philippine General Hospital. Please welcome a very good friend and my classmate, Dr. Vanessa-Maria Torres-Ticzon. Dr. Van?
Good afternoon, Raymond, and to everyone. Magandang hapon po sa lahat. Thank you so much for this invitation to be a reactor to a very relevant webinar. So thank you for your kind introduction, Raymond, my classmate. So according to the Philippine Statistics Authority in 2018, births to girls 10 to 19 years old are approximately 184,000. Of these, 2,250 are births from 10 to 14 years old only. They are so young. This shows a 63% increase since 2011, which is just a matter of 7 years. The majority, which is around 182,000, are from older girls 15 to 19 years old. Among the babies of adolescent girls, it is bothering that approximately 72% were fathered by men 20 years old or older. This is quite alarming since we clearly see here abuse. If the age gap between the adolescent girl and the partner is 4 years or more, but now, as mentioned by Dr. Bernie, 3 years or more, there is already a difference in their cognitive level of development and, of course, a difference in power gradient. Even if it does not seem to be abuse since they are in a boyfriend-girlfriend relationship, the not-so-obvious sugar-coated words of force or pamimilit of the older partner to the adolescent girl who has little power over an older man is definitely an abuse. Among adolescent medicine specialists, it is routine for us to do the psychosocial risk assessment. This uses the heads interview for all adolescents, even if they consult to us mainly for medical concerns. The acronym HEADS means asking for the home, education, eating, activities, drugs, sexuality, including abuse, suicide, safety, and spirituality. In short, these comprise the everyday concerns of an adolescent. In doing so, we are able to establish rapport, gain the trust of the adolescent, identify their risky behaviors in order to address and also prevent the worsening of the situation or of the concern, as well as identify their strengths and protective factors. This is crucial since our adolescents face so many challenges, especially during the pandemic. From being locked at home, which may be difficult, especially if their parents or their caregivers are not so supportive and would be judgmental of them, calling them pasaway or nag-iinarte, instead of being their source of support. They transition to the online platform, which is not easy at all due to the overwhelming asynchronous tasks that they have to face and submit every day that just keeps on piling up. From being cut off from their peers face-to-face who are their source of social support. Having mental health concerns, whether depression, anxiety, or both due to academic stress or other triggers like cyberbullying, which definitely needs to be addressed. The limitation in their physical activities that they can do, and so resorting to more screen time of almost the whole day, which already disrupts their sleep. So instead of having 8 to 10 hours of sleep that adolescents need, some have barely 5 hours and their sleep cycle has been disrupted. Their diet and food choices have also been affected. They could also be praise, P-R-E-Y-S, so that praise to online friends whom they barely know, who appear to be friendly and of the same age as them, but would later on take advantage, especially when they meet face-to-face, trusting them easily. And sadly, they can be victims of sexual abuse by people close to them and whom they supposedly trust, like their family members, their relatives, or their neighbors. Hence, we encourage all doctors to screen adolescents who consult with you, because if we do not screen, we will not be able to identify their concerns. At the start of the consult and prior to the psychosocial risk assessment, we state the confidentiality clause so that our adolescents would know that everything will be kept confidential, except if they plan to hurt themselves, the people around them, or if we suspect abuse. So those are the limitations to confidentiality. For an adolescent consult, we have a different format as compared to a usual pediatric consult. At the start, we interview them with their parent or the companion, but at the middle part, we ask the companion to step out so that we are able to talk with the adolescent alone and they would feel that there is a safe space to share their concerns. It is also a way of empowering our adolescents. But at the end, of course, we call back the companion or the parent to discuss the plans. Healthcare providers are mandated by law to report any suspicion of abuse. According to the Republic Act 7610, also known as the Special Protection for a Child Against Abuse, Exploitation, and Discrimination Act, that healthcare providers like doctors and nurses have the civic and the moral duty to report any suspicion of abuse. In the Philippine General Hospital, our adolescent patients, whether in telemedicine or face-to-face, like the teen moms referred to us in the UB wards, who have older partners of 4 years age gap or more, we report them to the Child Protection Network if the child is below 18 years old, and to the Women's Desk if they are 18 years old or above. We also inform the medical social worker so that they could make a home visit to check the safety of the child before sending them back home. In the community level or outside the hospital, they may report to the DSWD, the NBI, the Commission on Human Rights, the Department of Justice Task Force on Child Protection, or to the local barangay council for the protection of children. How about for our teen moms? Our key messages are as follows. Of course, to breastfeed exclusively, to do self-care and ask the help of other family members in caring for the baby since they cannot do it by themselves, to have their babies regularly checked up and to receive immunizations as scheduled, no? We encourage them to go back to school later on, no? And more importantly, in relation to our webinar now, we do not encourage cohabitation, no? We do not want them to live in with their partners since we want to avoid a rapid repeat of pregnancy. A rapid repeat of pregnancy means being pregnant again in less than 2 years. We want them to go back to school and also have a brighter future for themselves and for their children. Also, we teach our adolescents, especially our teen moms, about sexual and reproductive health, and we highly encourage the use of LARC or the long-acting reversible contraceptives such as the Implanon or the IUD being inserted prior to the discharge from the hospital as much as possible. I hope that every one of us will play a role in protecting our children, especially our adolescents, since they are the most badly hit by the pandemic. Maraming salamat po.
Thank you so much, Dr. Van. Very important points po with regards to the advice normally given by the Division of Adolescent Medicine in those cases. And we look forward to your participation in the Q&A session later on. Our next reactor is the past president of the Philippine Obstetrical and Gynecological Society and currently the head of the Task Force on Gender-Based Violence. Please welcome to the webinar Dr. Lyra Ruth Chua. Dr. Chua?
Can you turn on my video, please? Oh, there you are.
Yun, there we go. Okay.
Yes. Okay. Okay. Good day, everyone. I am Dr. Lyra Ruth Chua, and I would like to thank you, Doc Raymond, for the kind introduction. And I thank the organizers of this webinar series for the honored invitation to share with you. Can we have the next slide, please? To share with you in 10 minutes what we did in 18 years and how POGS responded to the problem of violence against women and children. Next slide, please. So may I start by saying that the Philippine Obstetrical and Gynecological Society, or the POGS, is the first specialty society under the PMA to incorporate gender-based violence in its residency training program. Next slide, please. And can we have the previous slide, please? Okay, so stepping out of the POGS comfort zone. And why do I say that we stepped out of the POGS comfort zone? Because initially, the obstetrician, who is usually the first point of contact, or sometimes even the only point of contact by these women victim survivors, we were embarrassed to talk about or to ask about any injuries that we suspect would be due to domestic violence or abuse. So therefore, being cognizant of this, in 2003, I created the ad hoc committee for violence against women because we realized that domestic violence or gender-based violence played an important role in the healthcare of the woman. The obstetrician gynecologist, who I said was usually the first point of contact in these women and whom they trusted, needed to go beyond the biomedical aspects of the woman's health and needed to attend to this neglected aspect of her health care. So we did awareness campaigns through workshop seminars carried to the regions of the Philippines, making our POGS members recognize their roles as advocates for the women in their care. Then institutionalization of VAUC happened with creation of the Women's Advocacy Committee, and from an ad hoc committee, it now became a standing committee of the POGS. And so every year, the committee was always available for services to the woman. And then we began work for integration of reproductive health and VAUC into the POGS residency training program. Next slide, please. So we continued strengthening VAUC advocacy. And finally, in 2006, the integration of RH and VAUC into the POGS residency training program happened. And also at this time, in 2008, the printing of the first edition of the source book on gender-based violence compiled by Dr. Lyra Reyes was done. Then in the succeeding years, we forged partnerships with UNFPA also and the Child Protection Network and support for the DOH Administrative Order 2013-0011 to establish VAUC desks in all hospitals and specifically for our purposes in all of the POGS accredited hospitals. And then also in 2011, the Council for Residence Education Enhancement and Development, or the CREED, Training of Trainers for GBV workshop was held. And so that went on, that strengthened the advocacy for VAUC. Next slide, please. So in 2015, this task force on gender-based violence was formed, and we began holding training of trainers workshops. And so we started in 2017 with 3 such TOTs. And for each TOT, for each workshop, we had the following topics, which we felt was very important for the obstetrician gynecologist: a legal framework, gender and sexuality, privacy and confidentiality issues, the initial approach to management of gender-based violence, gender-based GBV-based situations, treatment plan and referral, counseling, which is a very important aspect of the management, promoting GBV in the community, and how to testify in court, because a lot of our obstetricians and gynecologists are scared of being called to court to act as a witness, no? And then we always included the testimony of a survivor. So may I now recount also, earlier we had a disclosure by one of the those who were interviewed, but surprisingly in one of our TOT workshops, the survivor, the testimony was given by one of the attendees herself, an obstetrician gynecologist who disclosed to us and who recounted her experiences as a victim of abuse, also from a family member. So that was really a very, very memorable workshop for us in the task force. Next slide, please. So here are the cities that we went to during the succeeding years. Next slide, please. And in 2016, we came out with the instructional design and the GBV modules, and we submitted this to the Philippine Board of OBGYN for the certifying examinations. So that curriculum that we developed, the curriculum for residency training in managing victim survivors of violence against women and girls, is an outcomes-based curriculum with 3 objectives. Well, first is to practice gender-sensitive and evidence-based strategies in caring for victim survivors of VAUG. Secondly, to demonstrate effective collaboration with government and non-government organizations. And 3, to create programs to promote advocacies on preventing VAUG in the family and in the community. Next slide, please. So what did we do during the pandemic? We did not stop. Next slide, please. We continued to function, and so we had the reproductive health chair in 2020. It was Dr. Lucasan from Region 6, and in 2021 it was Dr. Ronaldo Santos, who was both members of the Board of Trustees. And these are the members that we had, and as you can see, the webinars that we conducted had speakers, luminaries in the field, in their fields. Next slide, please. So because of the abuse and the discrimination against the frontliners during the early part of the pandemic, of the lockdown, we came up with this infographic in support of our frontliners to fight back for our abused heroes. Next slide, please. Then we had our first webinar in July 9, and as you can see, our first speaker was our favorite, Dr. Madrid, who talked about lockdown. Is it more dangerous than COVID-19? And then we had another speaker, Dr. Clemente, who talked about the secrets behind the closed doors. The lockdown really resulted in a lot of abuses. And then, of course, we did not neglect the sexual violence in reproductive tract infections, which is often neglected when we deal with these cases. Next slide, please. Then we had our second webinar, November 19, 2020, where we tackled teenage pregnancy. And the theme, we called it Nanay na si Nene. And we had 3 speakers: teenage pregnancy, a gender issue, and then dilemmas in teenage pregnancy prevention. And we had Dr. Junice Melgar, one of our our experts involved in teenage pregnancy. And of course, the favorite, again, the favorite lawyer that we in GBV is Attorney Legarda, who talked about laws to protect women and children, insights from a legal expert. Next slide, please. And then this year, August 31, 2021, under our current POGS president, Dr. Benjamin Cuenca, we mounted a POGS unified fight against teenage pregnancy, again, in response to the epidemic of teenage pregnancy during these times of COVID. And we had 4 task forces: the Adolescent Health Issues and Perspectives, or AHIP. Then we had prepared the preparatory reproductive health education, priming adults for responsible engagement. And we had the task force on family planning and the task force on gender-based violence. And we had our speakers, Usek Perez, we had Senator Risa Hontiveros, we had Attorney Esquivel, and we had the Honorable Leonor Briones as our distinguished speakers during this webinar. Next slide, please. And at this point, may I also now report on the POGS nationwide statistics for the past years, 2019, 2020, and 2021. The report on teenage pregnancy. In 2019, out of a total live births of 784, those who got the teenage pregnancy rate of women less than 18 years old was 9.7. 2020, it was more or less also the same. Less than 18 years old teenage pregnancy rate was 9.24. And then in 2021, we had a decrease in the total live births. Accordingly, the teenage pregnancy rate also decreased to 7.95. But please remember that these reports are only from the POGS accredited institution. So this is how we saw it among our institutions. Next slide, please. Then we also mounted a survey on our POGS accredited institutions, who asking them which of them already have VAUC desks or units. And next slide, please. And out of the 88 POGS accredited establishments at present, we had responses from 30%, and 8 out of the 88 reported established WCPUs. So we really need to improve on this WCPUs in our POGS accredited institutions. Next slide, please. And then lastly, just yesterday, we held our 3rd webinar, and it was timed during the first day of the 18 days of activism against gender-based violence, with the theme Orange the World. And this was, of course, sponsored by UN Women. And again, as you can see, our theme was our VAW-free community starts with POGS. And as you can see, we have again Dr. Bernie Madrid, who spoke on child abuse. And then we had our speakers, Dr. Sharon Gianan Cruz, Dr. Madeline Amadora, and Dr. Lynette Lasala, and with Reactors from Cebu, POGS Cebu. They were the sponsors for this particular webinar. Next slide. And also during this webinar, the POGS Cebu reported on their POGS Cebu initiated projects, wherein they already had setting up of VAUSI desks, workshops in all of the hospitals in Region 7. And they also produced a pink handbook, which was a guide for the setting up of the VAUSI desks. And we all of the attendees recited the advocacy declaration of support to end VAUSI. So that was what happened yesterday. And next slide, please. And the ultimate accomplishment that we had for this year was the publication, but at the moment it's just an online publication of the handbook on gender-based violence. And this would now be distributed to all the POGS members, not only to the POGS members, but also to the non-POGS accredited institutions, and even to the non-NGO. And so yesterday, we also invited the DSWD regional director, and we handed over this book to them, this handbook. And this is a guide in managing VAUSI in the emergency room and in the OPD clinic for the trainee and the practicing clinician alike, so that they will know how to address a patient, a survivor, a victim survivor who will be admitted or who will appear in the ER and in the OPD clinic. So this will now be a big help to our members who still mostly are at a loss on how to face the victim survivor in the ER. Next slide, please. And so our future directions are, next slide, please, to encourage more research activities on VAUSI and gender-based violence among our members, to include VAUSI cases in the POGS nationwide statistics. So aside from just reporting teenage pregnancy, we want now to include the cases of VAUC and VAUG. And then lastly, to start conducting seminar workshops to cover all the regions on how to set up VAUC desks with the Region 7 experience as our template until all the POGS accredited institutions have VAUC units or desks. Thank you very much.
Thank you very much. That's Dr. Lyra Chua. Maraming salamat po, no? So, what should I say? It's heartwarming to hear all the work that's being done by the Philippine Obstetrical and Gynecological Society.
Thank you.
And really how you are spread out throughout the country doing this. And I think whatever way we can help disseminate more information about your work, count us in as a partner. Maraming salamat po.
Thank you.
Thank you. Okay, so we're going to our next speaker, and we've said this before that lahat ng talino ay kailangan natin para masugpo natin tong pandemya na to, no? So hindi lang mga doktor, hindi lang mga nurse, hindi lang yung mga nasa public health, pero kailangan natin ng minsan may mga engineer tayo, meron po tayo ngayong abogado. And you know, we always think of, well, in public health, we think of law as an instrument for public health. So law is one way to protect the public's health. And we are very fortunate to have with us today a lawyer who is very well known for her work in women's rights. And in fact, if you say the word women's rights, there's one name that comes to fore, and that is Attorney.
Thank you for that without going to medical school. Okay na yan sa akin.
Okay ba yun? Okay, so we'd like to welcome Kat Legarda, who is the director of the Child Protection Network Foundation's Director of the Child Protection Network Foundation of Bernie. And she's multi-awarded. She's known for taking a very strong position on this. And she will now talk to us about the importance of law in addressing this particular issue. So over to you, Kat. Dr. Attorney Kat.
Without a degree, yan, ha? First of all, it's very interesting that everyone talks about VAUC and everyone talks about gender-based violence, and everyone talks about reporting and what needs to be done. reporting VAUSI, reporting GBV in their surveys and in their WCPUs. But what is bothering lawyers like me who do the work is that doctors do not report to the police when teen pregnancies occur in their clinics. Clearly, it is a crime because a person who is 10, 11, 12 years old, 14 years old giving birth, that is clear sexual abuse. Consent does not come into it. As Dr. Vanessa said, there can be no consent if a person is much older and the child, or as the person on the street said, she didn't realize that she should not have kept it a secret because she wanted her family to be safe. And I think since all of you are doctors of medicine, it is really time to report to the NBI, to the police, to the barangay, to the Commission on Human, there's so many places to report to. When a child who is pregnant comes to you seeking your help, apart from just helping her have a safe delivery, I think maybe doctors should help that child also seek some justice for her life. As Bernie pointed out in her presentation, an 18-year-old with 3 children must have given birth starting at 14 years old. Are you telling me there's consent? She had 3 different partners, 3 different children, and finally killed her second child. So this is a crime. This is a crime. And while the age of consent is 12 years old right now, we are praying that the BICAM bill, which has just been sent to President Duterte for approval, for signature, for signing, below 16 will become the age of consent for this country. So clearly it's going to be more of a crime. Right now, prosecutors are filing cases not based on rape law, but rather based on child sexual abuse. If you have been abused below the age of 18, this is part and parcel of RA 7610. So I think Dr. Lyra knows that I spoke to their group in POGS. Please encourage your doctors to file report, okay? 16 years will soon become the age of consent. Below 16 is statutory rape. So please report it. You can report anonymously, you don't have to give your name. You don't have to give your name. What is important about this is that our law, the family code, does not allow a marriage of any person below the age of 18 years old. So this person reported on TV Patrol, talked about by Bernie, she could never have married any of the fathers of her children because she was below 18. The marriage is void. And yet, doctors also tell me that their parents of these young mothers say they married off their children. Impossible. They could not have married off their children. Anybody who knows about a marriage done of any person below 18, the priest can go to jail, the judge can go to jail, the solemnizing officer can go to jail. It's a crime. It's a crime for any person to marry a child below 18, okay? And at 18 years old, you need the consent of your parents. At the age of 21, you need the advice of your parents. So interestingly, our family code actually follows the developmental levels of a human being. That 25 years old is considered to be the age of maturity for marriage. Gender-based violence includes child abuse. Gender-based violence includes a woman who beats up her boy child because the boy child is different from the girl child who is quiet and masunurin. And domestic violence itself is a crime. And there are many ways. Every one of us knows at least one person who is abused or who has been abused. Many of us have wondered whether we should interfere because this is apparently problema ng pamilya. But domestic violence is a crime. The late Katrina Constantino David, when she was handling NGOs, told us that she would organize communities in Quezon City to fight domestic violence. So for example, what the community did is that they would identify, because they know, community knows where domestic violence is occurring. So they identified these homes. And when they would start hearing the screams or the throwing of cases or the shouting, the community would get together outside the home and they would throw stones on the roof so that the perpetrator of the abuse knows that everyone outside is aware of what's going on. This was before Republic Act 9262. Now that there's Republic Act 9262, a police officer can come in and arrest the perpetrator without a warrant, and you, as a citizen, can have a citizen's arrest and arrest the perpetrator without a warrant because the abuse is ongoing. A crime is going on in your presence. I don't want to say much more because there will be other reactors and we don't have too much time left. However, I want to refer you to a free I guess it's a work. We have a free 4 hours course. You can access it on child protection at this organization, childprotectionnetwork.org. You can register for our 4 hours. 4 hours meaning recognizing, recording, reporting, and referring women in child abuse. It's very short. You can do it in one day. It's completely free. You don't have to pay for anything. You don't have to pay for anything. You just register and you just take it. It's 4 hours, and I've requested, so childprotectionnetwork.org is where you can register for it. I've asked lawyers to register for it, IBP members. We require doctors and nurse and social workers and the police officers who want to set up women and children protection units around the country under the Child Protection Network Foundation auspices. We have 114. We require everyone to do the 4 hours course first, and then they'll do a multidisciplinary training course before they do the specialty training course to be a child protection specialist. So any person can register. You don't have to be a doctor. You don't have to be a nurse. You don't have to be a social worker. You can be an ordinary tao lang naman tayo to register. And I think this is very important because the 9% figure of POGS is low because most children give birth either at home or with midwives or in POGS, non-POGS accredited centers. Like even my daughter, because it was the pandemic, gave birth at home, but she's in her 30s, so there's no abuse there. So please register if you're interested. It's very short. You can actually do it in just one day. Thank you very much. And we'll see you at the question and answer session.
Thank you very much. That's Attorney Katrina Legarda. And again, more hope. It's a very serious topic we're covering right now, but I think all our speakers, Bernie, Van, Lyra, and Kat, are talking about solutions. What can we do? So at this point in time, we're going to call everyone back into the to open their. I mean, all our speakers to open their videos. Bernie, Dr. Van, Dr. Lyra, Kat, and I'm gonna turn over to Raymond now. Raymond, over to you.
Thank you, Attorney Legarda. Very important that we get the legal perspective, at least, just so we get some sense of those things that really happen and what are our legal remedies, if any, for those who are victims and who have experienced this. Before we go on with our Q&A session, let's take a very, very quick break for a special public service announcement today. TVUP.
Sigurado ka na ba sa reservations natin?
Oo naman.
Bakit bihis na bihis ka?
Oo, magiging escort mo ko eh.
Mukhang may date si lolo't lola.
Ilagay mo kaya ito?
Ang ganda naman.
Maganda yan. Special ang lakad natin. Ano, ready ka na?
Ready na. Mom, Dad, aalis si lolo't lola. Oo, anak, after lunch. Sa nalakad niyo po. Para sa atin lahat ito. Magpapabakuna kami dahil mahal namin kayo.
Dahil mahal ko kayo, magpapabakuna ako.
Thank you so much, TVUP. The COVID communication public service announcement is one of the many outputs of the UP research entitled Communicating COVID-19 in Post-Quarantine Philippines. It's headed by UP Vice President for Public Affairs, Dr. Elena Pernia, and funded by the Department of Science and Technology, PCHRD, and the Department of Health through the AHEAD HSPR project. Over to you, Dr. Susie.
Okay, thank you very much. So I'd like to thank all our speakers for their time, for their powerful presentations, and we'll kick off our panel discussion with a question around the disclosure that we had earlier from the interviews done by TVUP. So, how do you approach, or how do we speak to a person who is in need of help and disclosing that they're experiencing violence at home? And we'll go through everyone, and then we've got a couple of other questions in the chat box and in the Q&A. But let's start with that. How do we approach this? I know I think everyone should take advantage of Attorney Kat's training program, because I guess that's where we could build some skills. But just in general, what is the approach? How do we talk to somebody who's seeking this kind of help? We'll start with Bernie. Bernie, ikaw muna.
Yeah. Thank you, Susie. The approach for women and the approach for children are not the same. No, it's different because of their age and developmental stage. There is mandatory reporting actually for children, whereas there is no mandatory reporting for women. But if a child, you suspect something is happening, even if the child doesn't say anything. Whoever you are, you may not even be a doctor, you are a relative, or a friend. The thing there is that you should always start with an open-ended question. So, meron ka bang problema? You seem to be troubled. I'm here to listen kung ano man yun. Now, once the child discloses, you should always give the child time to talk. Don't interrupt. Don't put words into the child's mouth, and do not appear shocked or angry or blame the child, because always the first reaction is to blame the child. Like, ano bang ginawa mo? Kaya siguro nangyari yan because of something that the child did. always make sure to reassure the child that none of it is her fault and that you are here to help. Now, for me, the easiest, if there is a women and children protection unit, the easiest really is to go there. Okay, so to go, because then you have everything under one roof. The doctor, the social worker, the police, the psychologists, they're all under one roof. So that's the easiest. But if there's none, if there's no WCPU, then it's a problem. I would say you can choose to go to your trusted doctor or to the social worker of the local government unit if you're not yet ready to file a complaint to the police. Now, it doesn't, as we tell everyone, our number one concern is the child's safety. No, na hindi maulit yung pang-aabuso. That's number one. And then number two is the health, both physical and mental. Justice, of course, is also very important. But we could, of course, see how it can come in without further traumatizing the child. That's why the WCPU police officers are well trained to do that para na hindi ma-retraumatize yung bata. In fact, we advise that everyone should get trained also on trauma-informed care. Not only doctors, but everyone dealing with children should be trained in trauma-informed care so they'll understand what to do with a traumatized child. Now, for a woman, you also approach the same way that it's open-ended. But the difference there is it's the woman's choice, what she wants to do. You do not label her and say, oh, you're a battered woman. So you don't label her. You just give her options and tell her what her choices are para alam niya meron siyang options. But also the same goals of safety and physical and mental health and justice once she's ready. So I'll stop there so that the others also have opportunity to say their piece.
Thank you very much, Bernie. Let's go to Dr. Van. Van, go ahead.
Thank you, Dr. Susie, for the question. So first of all, we have to talk to the child or to an adolescent in a respectful and non-judgmental manner so that they will be comfortable talking to you and sharing their concerns. No? However, if we already see that the main concern is abuse, we don't ask them to narrate everything anymore because it will be like reiterating what happened and it could be traumatic again for them. Instead, we already accompany the patient and the parent to the child protection unit, no? And we have to explain it to the mother. And it's not easy, especially if it's a case of incest or a family member is the one who is a perpetrator. Sometimes, ma'am, it's like a balancing act, no? Because if a child or the adolescent is abused, usually the mother is also battered, no? And we also say na they can seek help in the women's desk also. We have to accompany them to the women's desk or child protection unit because they might just leave and run away because they know that doing so will be a threat to the family, and usually the father is the breadwinner. No, and so the adolescent becomes burdened by guilt of having the needs will be taken away from them, no, kasi walang mag-earn for them. And of course, we're mandated by law to report any suspicion of child abuse. Hence, we have to direct them to the child protection unit. We're just lucky in PGH that all the services are in place po. Okay, so aside from that, they have to be referred to the social worker. So even before asking them to be discharged, the social worker makes sure that the environment is safe. So nag-home visit po talaga. But now, because of the current situation, maybe they have to do the home visit by, usually they tap the local social worker to do the home visit themselves. So safety is the priority, especially for the adolescent or the child who is being abused.
Okay, thank you very much, Van. Let's go to Dr. Lyra. Dr. Lyra, please.
Yes. Okay. In the POGS webinars and the workshops that we hold, we emphasize the compassionate way that the obstetrician gynecologist should respond to the victim survivor. We should not be judgmental. We should not jump to conclusions, kasalanan mo yan, or something that in that way. And we do emphasize also, we give our members healing messages, and we give them the script mismo, no? So we say, you can say this, it is not your fault. No one deserves to be hurt like this. And then we are ready to help you. We are here to help you. If they disclose, then well and good. We do whatever we can. If she has medical problems or anything that needs surgical referrals, then we do the necessary management. If they prefer not to disclose, then we don't force them, but we give them the message that we are here. We are always ready to help her whenever she is ready to disclose.
Thank you very much, Dr. Lyra. Let's go to Attorney Kat Legarda. Kat.
I don't see them until they want to go to court, you know. So it's up to the doctors first.
Yeah.
But I noticed that the battered women who do go to lawyers are those who have been able to seek very good help from their from the doctor. Because the doctor they finally went to a doctor who actually believed what they said. Because many battered women, you know, they live in Forbes Park, in Dasmariñas Village, may mga mayaman din. You know, many abused children, may mga mayaman din. And to have a first, I guess you call them first frontliner, to believe them that just because their husband is a senator or a justice of the Supreme Court, that they are abused, okay? So that's, mostly battered women don't go to court. They don't. And it is very interesting to me and to all of us who I used to, retired, but very interesting to us that you know what makes a battered woman actually go to court to get rid of her husband? Because he was unfaithful to her. She would say, sa dami kong naranasan, you know, binubugbog ako, ganyan, ganyan, tapos may kapit pa siya. And that's when she goes to court. It's really shocking. Shocking. But that's what happens. So when I also give lectures on domestic violence, of course, I don't propose murder, okay? But the law recognizes the battered woman syndrome, such that if after abuse, the woman kills her abuser, police officers actually don't charge her anymore because she can have her defense, the battered woman syndrome defense, heard ahead of the prosecution. So I don't recommend murder. I recommend you just leave, you just leave your abuser if you can. I recommend that those who want to help a battered woman, give her cheap cell phones, always charged, with a SIM, with a number already pre-registered. Hide these cell phones in all areas of the house so that after an abuse, she can call and somebody can come in to rescue her and the perpetrator can be arrested. So she doesn't have to kill. How's that? Very simple.
Very nice. Very provocative, Kat, as always. No, but yeah, very good point. No, parang I love the idea of having cell phones and means of reaching out for help. Okay, we're gonna turn over to Raymond, who might pick up some questions from. I think we have time for 1 or 2 questions from our audience. So Raymond, over to you.
Thank you, Dr. Susie. Many, well, at least I've seen, we've had 2 cases na po for today of disclosures from our live audience. And we appreciate the trust that you have given us to our program for you to be able to share your experiences. I'll just pick out po a few that we have here. in our Q&A. The very first question po is how do you give that advice, or what is the advice that you give when parents of the minor do not want to file a case because they do not want to ruin the reputation of the child victim po? Anybody from the panel can answer.
Yeah.
Do you want to do it first, Bernie?
Yeah.
Go ahead.
Yeah. There are two things there, no? One is actually, as I said, when they're not yet really prepared, it's not like we are really pushing prosecution immediately. No. But number one is that the child should be safe. The child is absolutely not safe if the child is living with the perpetrator in the same house. No matter what everyone in that house says, the child is not safe if they are in the same house as the perpetrator. I keep on repeating that. No promise, kahit luluhod pa dyan, at kung ano pang promise na they will be struck by lightning or that God will kill them on the spot if they do it again. No promise is ever kept if they are in the same house. So if there is no case that's filed and the perpetrator is there in that house, the child is out of that house. So yan ang masasabi ko. And then later on, somewhere down the road, once child is ready, the case can be filed. But it doesn't have to be filed immediately. But for the battered woman, remember you have the protection orders, no, different kinds. Okay, that's what I have to say.
Yeah, Kat, go ahead.
Going to court is a whole different banana, okay? Doctors hate going to court because they're afraid of the cross-examination. When actually, if you are a trained specialist, judges will accept already your report without allowing too much cross-examination. So doctors should not be afraid to go to court anymore. They're POGS accredited, they're protection specialists. The courts will accept your reports without any problem, truly. And very few lawyers will dare, because the judges are trained by us not to bully, not to allow bullying in court also. Okay, so Dr. Lyra.
Yeah. That's what we tell them. Don't be scared.
Yeah, in fact, that's part of our MDT training, testifying in court, which is the next ladder up from 4 hours. Secondly, not every person, I don't know what reputation is the child going to have. It's not her fault that she was abused.
Yeah.
It's the fault of the perpetrator. Yeah. So the reputation that people are talking about is the reputation of that big time guy. That, wow, he's a doctor. What will people say about him, diba? Or he's a judge. What will the legal society say? I don't think we should be concerned about the reputations of perpetrators, because they should be in jail. They should be in jail. Number two, when it comes to the child, our rules on the examination of a child witness, actually the child is no longer an absolutely required witness in court, because our rules on the examination of a child witness allow hearsay testimony and expert testimony to take the place of the testimony of the child, who could be called, what is it called, Bernie? The unavailable child. The unavailable child. Either she has been threatened, there has been desistance. In fact, the Supreme Court is very good about desistance, where the child and the parents are paid off so that they don't testify in court, so the perpetrator can go. The Supreme Court said no. A desistance should be very carefully looked at, because the desistance means that money exchanged hands. So, yeah, the first thing is justice, and the first thing is safety. Like the case of Halos Hoss, remember, Susie, you were there, I don't know. You were, the case of Halos Hoss, she has married, happy, with children. Why? Because in the end, people believed her and she got justice. She told me, even if Halos Hoss had been acquitted, she would have still felt good because at least she could tell her story and people believed her. And for the woman and the child, the person who believes the abuse is already part of the healing of that person.
Yeah. Thank you very much. Raymond, we've got some good questions in the Q&A box. You want to go and walk through some of them? I think we can do another 5 minutes of that. Yeah, go ahead, Raymond.
I'll just aggregate a few of them. And some of them are with regards to the availability and accessing help, psychological help, I suppose, and mental health assessments and interventions. Well, you have mentioned already po the training courses, but what could the panel advise in terms of the available resources and interventions po for those who are seeking such references? Anybody from the panel?
Tsaka siguro, Raymond, I think the question also is, Bernie, no? I mean, obviously we don't have enough resources. I guess the other thing is, what does it cost? No, parang what is the burden on the victim on this issue? Sige, go ahead. Anybody can answer. Please go ahead.
Yeah, we certainly do not have enough mental health services. There are only 700 or so psychiatrists in the land and like 1,500 psychologists. And most of them are not clinical psychologists. So, and majority are in NCR and nearby provinces and not in the far away provinces. So unfortunately, the Department of Health has a lot of work to do so that the Mental Health Act, the Mental Health Law should be enacted and implemented. Because right now, kulang wala. So but for those who come to the WCPUs, the services are free. No? So wala kayong igagastos doon. In fact, even filing of the case, there's no expense. But the expense there is just because you have to go to court. So pamasahe mo and you'll be, if you're a day worker, of course wala kang sweldo sa time na you are in court. But wala kang binabayad sa prosecutor or sa filing of the court case. Walang bayad, libre lahat yan. So I don't have a perfect answer because yes, we really lack mental health services, and the solution there will not come until a long time. Right now, we are trying to train lay people to give trauma-informed psychosocial therapy, but that's not enough. That's just for those now who really don't need much treatment. But even then, for those, konti lang yung nagte-training because again, it needs time to do therapy. When you say na social workers should be trained to do it, when do they have the time? Even just for the case management, they do not have the time because ang dami-dami nilang trabaho. So saan pa sila kukuha ng panahon to do therapy kung sila din yung aasahan ng magbibigay ng therapy? So the situation now is not ideal. But we're trying to see with telemedicine if we could recruit also more psychiatrists to be part of the telemedicine program. Pero that's a drop in the bucket in terms of the need. For me, that should be a priority program of the Department of Health. It needs, the Department of Health talaga, an approach that's systemic. Hindi pwede yung a little program here, a little program there. At hindi to pwede makukuha lang sa hotline. Hindi ganun yan. No? So, It might not be the answer that people would like to hear, but that's our present situation. But just to
Also-
repeat, the WCPU services are free, but we don't have enough mental health. Okay.
If you're in school, if your adolescent is in school, like UP, Lyceum, De La Salle, there is access to free psychological counseling. And in fact, we professors, we're supposed to be able to find out from our Zoom meet, from our Zoom classes, to check, are you okay? Is everything going on? Tell me personally. And we've been able to see people to refer for mental telehealth. So if you're from a big school like UP, you can send adolescent, college, at least College of Law, no? I don't know, Dr. Vanessa, no? But the College of Law, we have access with the UP administration people, ganun din sa De La Salle. And I always tell, in the very beginning of our quest to have WCPUs around the country, always the problem was the psychologist. And I would always tell the doctor, why don't you tap the psychology departments of the universities around you, because they will need some kind of OJT for their students. At least if they can be supervised, diba, by their professors, by the head of the department, they can certainly give some kind of, first response nga to a psychological problem. Again, as Bernie said, it's not ideal, but at least there's some, well, now that there's a pandemic, they're not open, but you know who the heads are of these departments of the various universities.
Yeah.
But even in those universities, walang clinical psychology. Puro corporate yan. Yeah.
That's where the money is.
Yeah.
Dr.
Okay.
Van, for your reaction.
Yes, I want to share in our adolescent clinic that is more of telemedicine po now. Around 70 to 80% of our patients whose main concern is mainly mental health po talaga, depression, anxiety, more than the medical. And it takes us at least 1.5 to 2 hours to be able to talk to each one po, especially on the first consult. And then we refer to the child and adolescent psychiatrist, but we know that it will take time for the psychiatrist to see them kasi ang haba po talaga ng line. So we start them with antidepressants or anti-anxiety drugs. And usually when they are seen by psych, they're better na po, no? So among our UP students, we have the health service that they can tap to be able to consult a psychiatrist. Especially in UP Manila, the Office of Student Affairs is active po to help our students, and also they are being referred to the psychiatry residents para may direct service po para sa kanila. But it is really true that mental health is very important, not just to of course, for our abuse patients and all our adolescents in general. Kasi po, if you do not screen them, we will miss on it. And po, non-suicidal self-injury, NSSI, or yung mga cutting po ng mga adolescents natin is very common. They see it as a coping strategy. It's not a good coping strategy, and it can lead to suicide later on. And we are really bothered with it. No? So when we do the physical exam, we check. I tell them I check the pulses, but actually I check for hesitation marks. I check for the abdomen. I check for the thighs, because sometimes they cut on the anterior part of the thighs or middle part of the thighs. No, but if you show to them that you are concerned about their well-being, they will be honest with you po, and they're also seeking help and would really appreciate you asking it of them. Thank you po.
Thank you very much, Vanessa. I wish we had more time, but we're out of time. And we're going to have a couple of minutes to give our speakers some moments to formulate their parting words for our audience. Meanwhile, Raymond, do you want to answer the questions and then do our evaluation?
Okay, can we have the 2 questions? There we go. Also on Mentimeter. Thank you so much. The 2 questions po are as follows. Sa tingin ninyo, anong age dapat pwede na makipag-sex ang isang bata? Overwhelmingly, 93% of the 397 respondents chose 18 years old. For the second question, we have, and this is the same for, for Zoom and for Menti. The second question, sa tingin ninyo, anong edad handa na maging isang magulang? 54% majority chose 26 to 30 years old, and that is in the Zoom, followed by 27% 22 to 25 years old, and 12% for 31 to 35 years old. In Menti, 63% of the 54 respondents chose 26 to 30 years old. That's followed by 19% for 22 to 25 years old and 15% for 31 to 35 years old. So, thank you so much po sa a little over 400 participants, respondents who participated po sa ating fun poll. Before we go on to our evaluation poll, alam po natin na napaka-busy po ninyong lahat. So, our team, we have selected a few presentations that will feature in its entirety. Ang tinatawag po namin, if you're familiar po, kung medyo regular po kayo at nanonood sa YouTube, this is what we call SCD Shorts. You can watch them at your convenience sa TVUP YouTube channel po. No? So, essentially, makikita po ninyo yung mga tidbits or yung mga very, very short snap videos po that we have prepared, and essentially just distilling the message from each of those webinars that we have selected. And before we go on to the final word from our panelists, we'll do our evaluation poll. We do not send out a separate evaluation poll. Can we have the evaluation poll, please? There we go. And this is the only evaluation poll that you will receive, and we hope that our 680 plus participants who are in Zoom will be able to participate po. There are 5 questions as follows. The panelists demonstrated thorough knowledge of the topic. The panelists were well prepared and organized. The panelists spoke clearly and audibly. The panelists used appropriate language with technical medical jargons adequately explained. And finally, the panelists contributed to new perspectives and knowledge on managing various key COVID-19 health issues. It's a Likert scale, so we'll try to relaunch it. Sige po, we'll relaunch it po. And it's just strongly agree, disagree, and strongly disagree. Over to you, Dr. Susie.
Okay, thank you very much, Raymond. So let's go to our parting words. So we'll start with Attorney Kat Legarda. Kat, go ahead.
Oh, I don't really know what to say. I guess just to remind everyone that domestic violence is a crime, but it's up to the woman to decide whether or not to report. But definitely, child abuse is a crime and must be reported, whether you suspect only or as a fact. So I hope we need the community. They always say it takes a village to raise a child. It takes the whole world, all of us Filipinos. We need to help raise safe children. Thank you very much for inviting me.
Thank you very much, Kat. Let's go to Dr. Lyra. Go ahead.
Yes, thank you, Doc Susie. Yesterday, during our webinar, which was open not only to POGS members, but also to the general public, actually, to all stakeholders, LGU, and other frontliners, one big question that was always asked is, where do we get training? It looks like everyone is really interested in doing something about gender-based violence. And thank you very much to Dr. Bernie and Attorney Legarda for giving us this childprotectionnetwork.org, because we can now tell them, regardless of where you come from, whether you're a doctor or not, you can log into this website, and you can get the 4 hours? The 4 hours of training, and somehow you will be empowered to be able to do something when you meet these cases in the ER. So thank you very much for this. We will use this as part of our webinars.
Thank you very much, Dr. Lyra from POGS. And let's go to Dr. Vanessa. Go ahead.
Yes, so When we deal with our adolescents, make sure that we approach them in a holistic manner, attending to their medical needs and also their psychosocial needs, no, using the heads interview. We have to be respectful and non-judgmental. And if we suspect abuse, we refer to the WCPU and to our social workers. For our parents or those with dealing with adolescents, if we know that they have mental health concerns, please don't hesitate to seek professional help. Thank you.
Thank you very much, Vanessa. And Bernie, go ahead.
Yes, thank you, Susie. For all who are in the health profession, just know that child abuse and woman abuse is very common. In fact, any injury that you see, your first differential should be abuse. For any injuries, unless it's obviously accidental, no? Unless it's obviously accidental, the first differential is that abuse occurred. Second, you should not hesitate to refer to the Women and Children Protection Unit. And if there is none in your province, then please advocate that they have one, at least in one hospital there, and get in touch with us at the Child Protection Network to help them establish their WCPU. There are only 23 provinces left without one. And last, just listen, no? Just listen to anyone who may disclose to you because you are a friend. So just as a friend, your number one priority is to listen and to give good advice and help them access services. So thank you.
Thank you very much. That's Bernie Madrid. Stella. Stella, right?
This is a very informative discussion, and I too have learned a lot from all our speakers. I appreciated all of them, and the message is very clear, and we have to protect our children and our women who are abused. It's really the video of the pictures of Bernie was very heartbreaking. You know, the mom who kept on spanking her child until the baby died. You know, that is so sad. Okay, so let's hope that this will not happen anymore. We can do our bit as doctors, and we have to exert all effort for this abuse of women and children so that it will stop. Thank you.
Thank you very much, Stella. So we're going to our closing remarks, and we have our chancellor from the University of the Philippines in Manila who will do the closing, but apparently Menchit can't open her camera, but please go ahead, Menchit.
Yeah, can somebody just allow me to open the camera? Okay, now I can open my camera. Okay, thank you. So today's webinar was opened by Dr. Stella Jose, and Dr. Stella emphasized the importance of team effort in addressing violence, domestic violence, and thus the composition of today's webinar. Representing the network that responds to domestic violence is our main speaker, Dr. Bernie Madrid, head of the Child Protection Unit at PGH and the Executive Director of the Child Protection Unit. Representing the roles of pediatric and adult health professionals are our adolescent pediatrician, Dr. Vanessa-Ticzon, and obstetrician, Dr. Lyra Ruth Chua. The last reactor is Atty. Legarda, who will address the legal aspect of the program. Dr. Madrid started by saying that COVID pandemic has aggravated the issues of domestic violence. During the COVID pandemic, just how safe are we at home? And are the children suffering unintentionally? Now, before COVID, the national baseline study showed that 66% suffered from physical violence, 58% from psychological violence, and 19% from sexual violence. And she continues to say that violence includes bullying, cyber violence, and even witnessing physical and psychosocial violence at home. Now, data has shown that the home is where the most violence is happening, and the most common perpetrator is a family member. And under high restriction, indeed, there is an increase in violence. Now, in the Philippines, at the beginning of the pandemic, there was a drop in reported violence, but she cautioned all of us by saying that possibly reporting was compromised because the women's units were diverted to COVID response. And likewise, the schools were closed and there were no means of reporting the students to the proper authorities. Now, however, there was a note of increase in child abuse-related injuries and also increase in family violence. Dr. Bernie shared with us that the suicide behavior is higher among abused youth during COVID. So, and also that there was an increase in online sexual abuse by 265% in the country. So let me just sum up what the CPU, the Child Protection Unit, has done to improve the access to services at the time of COVID. Well, for one, they've expanded their hotline. If you go to the PGH hotline 155-200, and you are a case of child abuse or domestic violence, you will be connected to the Child Protection Unit of PGH. The CPU also has realized that telemedicine will be one of their means of reaching out to the victims. And most recently is they've actually opened up the tele-CPU units around the country, now starting with 39 barangays and hopefully by 55 barangays by the end of the year. Recognizing they cannot do it alone, they have tied up with the Ateneo team to prepare the parenting tips as well as the use of social media, the MAPA Viber chat. I think the important thing is that, when at the end of the work of Dr. Bernie and her team, as she said, after 10 years of hard work, they were able to push that the age for statutory rape is now below 16 years old. And I think that is really a feather in the cap of the team of Dr. Bernie. Thank you, Dr. Bernie, to your team. Our first reactor is Dr. Vanessa-Maria F. She actually highlighted the statistics earlier presented by Dr. Bernie, and this is very important for us to remember. Out of 180,000 10 to 19 pregnancies, teen pregnancies, 2,400 were from 10 to 14 ages. And that means a 63% from 2011 to 2019. And most were sired by adult males. So in other words, we, the doctors, the nurses, the midwives in the audience right now, must learn that we must screen all our adolescents. She recommends the use of the heads to identify risky behaviors so that we can address and prevent them from worsening. And maybe just a review from the pediatricians of the audience: head, H for home, E for education, E for eating, A for activities, D for drugs, S for sexuality, S for suicide, S for safety, S for spirituality. Now, Dr. Van, I think this is very important for us to remember that she emphasized that we should discourage teen moms from cohabiting with their partners to prevent the repeat of pregnancy. At PGH, the teen clinic actually helps them with sexual and reproductive health and encourages them to go back to school and to actually use long-acting contraceptives. The sharing of Dr. Lyra Chua is, I think, very important for all of us in the audience, because she started by saying that at the beginning, the health professionals were uneasy to ask about abuse. And maybe that still happens to all of us in the audience right now. In 2003, she started creating the ad hoc committee on violence against women at POGS. And I think, that awareness campaign made a lot of difference because her advocacy has come a long way. So now we have the Violence Against Women Committee becoming Violence Against Women for deaths in the hospitals. So now the VAUSI, so we don't only have CPU deaths, women units deaths, but we have VAUSI deaths becoming part of the hospital system. And she has pushed for the inclusion of violence against women in the curriculum, in the training of the residents. So thank you to POGS for continuing the training of our trainers so that we will be able to future mothers of our country. During the pandemic, they've increased their webinars and their infomercials to make sure that the health sector is prepared to respond to domestic violence, sexual abuse, and teen pregnancy. At the end, she said, what we need? Research, more VAUSI desks, and a better understanding of the gender-based violence. Our last reactor is Atty. Katrina Legarda, and she started by saying that there is a positive in reports. She said, doctors, when you see a patient in your clinic, do report them. Keep in mind that no consent, there is no consent if there is an age gap, and that is a crime. She encourages all doctors and health professionals to report keep in mind that 16 is the cutoff at the point. If you're quite anxious, then just keep in mind that a reporter can be anonymous. Keep in mind that marriage below 18 is void. Remember that gender-based violence includes child abuse, and that child abuse is a crime and must be reported. On the other hand, domestic violence is a crime, but it is the choice of the woman whether she wants to report it. In closing, Attorney Legarda invites all of us to the free 4-hour course on reporting, recording, and referring violence. So, at the end, after watching this webinar, we now know that staying home is not always safe. And as frontliners, we must learn the skills on how to best handle disclosures. And as a community of health workers, I agree with all our panelists, our speakers and panelists, that together we can stop this violence. So let us keep the community safe for our children, be an advocate of child abuse and violence against women. Magandang hapon po sa inyong lahat at back to you, Susie and Raymond.
Thank you very much. That's our Chancellor for UP Manila, Dr. Carmencita Padilla. And before we close, I just wanted to say something about the questions that we had, Raymond, right? Everyone, no one's going to answer that sex should be started early or that young people are ready to be parents. But since we're seeing a lot of that in society, then there is something wrong. There's really something wrong. And I think your answers just validated that what's happening is not acceptable. As Kat has mentioned, the cutoff is going to be 16 years old. If you have an age gap that's more than three years, then we know that this is not something that is of the will of those who are victimized. Okay, so next week we've got a great topic. It's going to be clinical updates on COVID-19. So I think since the pandemic started, there have been so many changes in the drugs, in the management of COVID-19. And when we first started this webinar, we wanted this webinar to be the channel for you to go to know about treatment. And of course, we've gone beyond just treatment. Like today, we're talking about the side effects of a lockdown, which is very serious, child abuse, suicide, etc. Next week, we're going back to clinical management. So invite your friends to join us because we have expert clinicians who are going to talk about the latest in management of COVID-19. Raymond, over to you.
Thank you, Dr. Susie. And thank you also to our Chancellor for another excellent synthesis and closing remarks. We hope marami pa po sa ating mga nasa Zoom ngayon. Mas maimbita po nila ang kanilang mga kaibigan, katrabaho, kamag-anak na mag-join po. We have 2 more remaining webinars for year 2021. And we hope you'd be able to participate some more before we take our Christmas or our holiday break po. Thank you very much din po. I know marami po sa inyo nakaka-experience ng ating technical glitch with regards to the panel evaluation poll. We hope that's something that we could look into and fix before our webinar for next week. But before we conclude our program, let us first acknowledge the very hardworking team behind the Stop COVID Deaths webinar series. Without each and every one of you, our learning series and our credible online community will not be possible po. So maraming salamat po sa bawat isa sa inyo. And finally, all Stop COVID Deaths webinars are archived for viewing at the YouTube channel of TVUP for your convenience. Right after this webinar, i-archive na rin po ang webinar number 80, which is this webinar po in YouTube, and we hope you'll be able to watch them again, especially for those na medyo na late po sa pasok and those who would want to learn some more. Medyo namin po ang mga nuggets of wisdom from our panelists from all 80 webinars po. Please feel free to watch them in the playback sa ating YouTube channel. This formally closes our webinar for this week. napansin nyo po, nabanggit na po ni Dr. Susie ang ating very, very interesting updates to clinical management of COVID-19 for next week. And so we look forward to each and every one of you again next Friday from 12 noon to 2 p.m. It's a date.
Together we can stop COVID deaths.
So keep safe, keep healthy, and see you online.
The enemy remains unseen. I'll keep your hand in mine. Let's say a prayer one more time. I know you long for home, but I am here, you're not alone. I'll stay with you until the coast is clear. The others pain before my fears, the others laugh before my tears. But right behind the mask, I look into myself and ask, do I have strength to carry on? My God, how long must this go on? I need you here to keep me strong. I'm here to hold the line. I'll keep my word until my time. Look into my eyes and say his name to realize it's fine to be afraid. Just hold on to the word he gave. This time will come to pass, 'cause this salvation's made to last. He'll carry you to see the break of day. The others pain before my fears, the others vows before my tears. But right behind the mask, I look into myself and ask, do I have strength to carry on? My God, how long must this go on? I need you here to keep me strong. I'm here to hold the line. I'll keep my word until my time. The others pain before my fears, the others laughs before my tears. But right behind the mask, I look into myself and ask, do I have strength to carry on? But God, how long must this go on? I need you here to keep me strong. I'll keep my word, your word is mine. The others pain before my fears, I'm pushing on despite the tears. Please take us through another day. Just hold my hand, I will hold the line. I will hold the line.